Okay, now I'm going to show you an origin and insertion technique. We use origin and insertion techniques for the same purposes as a Golgi tendon organ, because origin and insertion is essentially a Golgi tendon organ technique, but we use it on muscles that have very short tendons. So Golgi tendon organs are for long tendons like the hamstrings and the Achilles, and origin and insertion techniques create that distension in muscles that have very short tendons. So the glute max, actually all of the glutes are a perfect example of this. Their proximal tendons or their origins around the iliac crest are very short and flat to the bone. Same with most of the sits muscles, so most of the rotator cuffs. So I'll show you this technique also on the infraspinatus. But first I'll show you the glute max. So the origin and insertion technique is based on knowing where the tendon is. So the most visible or most palpable part of the tendon, it goes from the sacrum, from its sacral attachment, all the way up and around the iliac crest. So I'm just palpating the iliac crest here. I'm getting a sense of where her glute max is. Somewhere around here, I know it becomes glute med. And then if I went further towards the ASIS, I know I would be on tensor fascia lata. So if I specifically want to target glute max, then I need to palpate, figure out where it ends. With this technique, I start more proximal. I'll start at the sacral insertion and work my way around. If you did keep going all the way to the ASIS, it's not a bad thing necessarily. You'll just get glute max, med, and a little bit of TFL. So it depends what's going on for the person. Say, you know, I had a client once who came in and they were playing baseball and they actually took a baseball right to the glute. So she had a big bruise here. I wasn't able to work on the muscle belly, but it had been a few days. It was starting to heal up. I couldn't press in this area. Things were still starting to heal and the tissue was fragile, but I could do this technique to help release the glute max, and I would kind of take a look at wherever that injury was. And since it was here, I just went all the way around the iliac crest to affect any of the muscles that might have been affected by that injury. So glute max, O&I technique, we're trying to tack down to the bone. So the palpation is very important here. You have to sink in, allow your fingers to sink in. Imagine your fingers going directly towards the bone. So we're going directly towards the ilium, and we're not using any oil. We don't want our fingers to slide or slip. We're not trying to affect the skin or the fascia or the superficial layers. We want to get to the tendon, which is attached to the bone, obviously. So I have been slowly kind of sinking my way in. When I feel like I've gotten to a good depth where I really couldn't go any further, where there's the highest level of resistance underneath my fingers, then I'm going to start my technique. So again, just make sure you instruct your client to breathe. So Paige, just continue taking nice deep breaths throughout. And we're going to create that plus symbol like I showed you in the lecture. So I'm going to go one way first. So I'm going like this. I'm going to exaggerate it so that you can see what's happening. So it would be like this: 1, 2, 3. And I'm not coming all the way out of the tissues. I'm staying down deep and tacked to the bone. And then I am doing 1, 2, 3 strokes in one direction. Then I'm moving my hands in my body so that I can maintain good body mechanics, but I'm keeping my fingers in exactly the same place to create the other side of the plus. Then I go 1, 2, 3. So that completes the plus in this area. Now it's okay to move your hands up. So now I'm going to the next part of the tendon. And again, you can see I'm using reinforced fingers here. If my fingers were like this, I'd be in big trouble. That creates a lot of pressure on your joints. So you're gonna have to create some strength with your hands here. Make sure you get into some flexion, support, and remember that the top hand is the pressure hand and the bottom hand is the palpation hand, or it's the leading hand. That shows you where to go. So 1, 2, 3. Come around this way. 1, 2, 3. And then I'm going to move to the next. I'm exaggerating it here, but it's actually a little bit more subtle because you're creating just really tiny little plus symbols. If you think about the Golgi tendon treatment on the Achilles, there was a real bowing of that tendon. Think about doing that, but on a miniature scale with these really short tendons in these muscles. 1, 2, 3. And you can take your time with this, you know. If we wait 30 to 60 seconds for a release with the Golgi tendon organ, then it means we have to go nice and slow with the O and I as well. And remember to move your body around the technique. This is true of any technique that you learn. You want to maintain good body mechanics, good posture. You want to have all your joints stacked. If you don't, you're going to create a lot of pressure in your joints and you won't have a long career. So I'm just working my way all the way around the tendon. So I'm just going to keep going with this. 1, 2, 3, 1, 2, 3. And I'm going to keep working my way all the way around the iliac crest, affecting the muscle that I want to affect. So with glute max, I'd probably stop around here. Glute med starts around here, and tensor fasciae lata is in the front here. So if I only wanted to affect glute max, I'd be ending about here. So hopefully that makes sense, and I will show the same technique on another muscle with the short tendon, the infraspinatus.